So with the nurses, their role to achieve optimization, they will need to show consistency in order to deliver what's best for the patient. Obviously, it's a two-way communication. Principles that have come down from the directors and strategists of the NHS include understanding the patient's experience, where they've been, what they've done, the treatments they've had in the past, their culture, race, sex, age. All these kind of factors would relate to the kind of medicines that that would be suitable for them. The evidence of the medicines themselves, whether they work on that particular person in history or in their case studies. Also, ensuring that the medicine is safe and isn't going to kill them, obviously. But above all, the chief principle is the optimization could only be achieved if, one, that everything is followed, all the procedures and methodology is followed, and also there's a cadaver from the Department of Health, like an independent body that's going around checking, measuring the performances and monitoring that nurses are following the processes. The Nursing Midwifery Council, they have a code of conduct which stipulates that nurses, when they're administering pharmaceuticals, should do it safely and effectively, obviously. They need to adhere to local and national policies, especially in accordance with the Department of Health. That they should also demonstrate that they're proficient, accurate in calculating dosages, and they know how to, the routes of the drugs themselves. They need to know how to put them into the body for that particular person, which means they will have to be familiar with the Royal Pharmaceutical Society's 2019 guidelines, which includes things like delegation, seeking help where necessary, knowing when someone can self-medicate and when they can take their drugs without authorization, that they have appropriate training and professional qualifications to administer drugs. And also, one of the policies would be to do everything separately, like prescription, dispensing, supplying and administration performances would be done by individual people to ensure that less errors take place. Where it's not possible, maybe somebody shadowing the nurse or auditing the trail so that so this can be double checked. Other things include using the right equipment, the right syringes, the right drips. Also to know, nil by mouth, what the procedures are. You've got keep the records up, why people are refusing treatment, why people are not taking their medication and saying they are, just how to escalate that and to take appropriate action. The storage of the drugs, that they're kept secure, dry. If someone's self-medicating, they don't need authorization, and so on. The identity of the medicine, the expiry of the medicine. Also, to summarize, the organisation procedures are like the patient's ID, the medication they should be using, the prescription, whether it's legal or not, clear labelling, the strength dosage shown, detailed, etc. Consent is considered and asked for. Allergies and adverse side effects are looked into. So consent would be like for someone underage, someone elderly with dementia maybe, and also the route of the drug, like where it's supposed to be added. Yeah, so not somewhere where it would be too strong or somewhere where it wouldn't be effective. The timing, the frequency of the drug, the amount of the drug, the start and finish time dates, and all of that would need to be recorded. In the next section, I'm going to be discussing thermoregulation in the muscles themselves, in the muscle cells themselves. I'm going to be discussing erythropoiesis, which is red blood's production. This would be in the bone marrow, and the calcium cycle, to do with depositing and secretions of calcium into the bloodstream. Just a quick look at the skeletal muscle. This is a straighter muscle. It's voluntary. It can be moved voluntarily. Its messages come from the somatic nerve system, with the central nervous system from the brain. It's cylindrical, as you can see, and its job is to contract and perhaps produce heat. One of its main specialisms is that it can hold a lot of calcium, and what it does is it regulates through the surface, which is called a sarcolemma, and through T-tubules calcium can move in, and this prohibits a certain protein from moving and moves it out the way, so that two other proteins can slide over each other and create a contraction. This diagram shows it a little bit more clearly, with the action potentials running along the synapses there and getting to the end terminals of the muscle fibers, and in doing so they trigger off a contraction. Obviously adenosine triphosphate would be necessary, or energy, but without calcium this wouldn't be able to continue, because it inhibits one of the proteins. I think it's tropsin, yeah? And there you go. To go into more detail, you can see those kind of Christmas balls running along the top. That's actin, and that gets pushed across by myosin. You can see those like pinkish clubs that come up using ATP and calcium pushing away topsin, which is another protein which is out of the picture there, and this creates contraction or a movement to the center of a muscle unit, a sarcomere. So no matter what age you are, when the body heat falls below a certain optimal level, the skeletal muscles will increase in activity to create heat by shivering or not shivering, as the case may be, and vasoconstriction might follow after that. So to summarize, the physiological levels, triggers could be age, where as you age you're less likely to produce as much muscle, and that turns to fat, so you'll have a lower metabolism, so you're more susceptible to getting cold, and that would cause an imbalance. So more fat, so it's people who have more fat than muscle, so females have more fat than males naturally, and a genetic disposition where you're just not able to develop as much muscle as you'd want. And if obviously, so this moves on to behavioural triggers, which includes an inactivity, like a lack of exercise, being in cold weather, moving to cold weather or whatever, not wearing the right amount of clothes because you're ill or because you're mentally impaired or whatever, fever, like a lack of heat, a lack of hot fluids and stuff, just not looking after yourself really, stress maybe, you know. So psychological triggers might include, obviously stress and illness is in there, but depression might be one. It might be social anxiety, might make you nervous, you might become embarrassed, and that might generate heat in the muscles. Fight or flight, you might have a trauma, you might have a situation where you need to react, and that might cause adrenaline to rush, and that might trigger heat in the muscles, or higher metabolism at least. There you go. So to quickly outline the calcium cycle, in the bone marrow you can see that if there's too much calcium concentration in the bloodstream, if there's too little you get the parathyroid gland becomes activated and starts producing its hormone, which will just inhibit osteoblasts and start stimulating osteoclasts to start dissolving calcium so that it can be taken up by the blood. In the kidneys, this will affect, the hormone will affect the kidneys to produce calcitriol, which will allow calcium to be taken up into the intestines. And then when the levels become high enough again, or they become too high, the thyroid gland will release its own hormone. In this case, it's calcitonin from a follicle there, and the opposite effect will happen to try and readdress the balance. So it's a negative feedback loop. So some triggers of calcium imbalance would be, or causing calcium imbalance would be small bones. Obviously, with less bones, there's less density. Smaller bones, less density, and more chance of becoming thinner, having thinner walls. Which would cause osteoporosis. This is quite common in people as they get older because the parathyroid gland becomes hyperactive and it starts dissolving too much calcium into the blood from the bone surface. Behavioral triggers. So in high altitude, where there's less oxygen, high D can increase production of red blood cells up to 8 times. Woman to lose more density in her bones, which again causes an imbalance in the calcium cycle or in the body. Like a lack of gravity may trigger an imbalance or a deficiency, where like astronauts, for example, have experienced when they've experienced weightlessness, come back to Earth after a long time, they're unable to walk because their bones are now are not strong enough to hold their own body weight. So just the right exercise, food choices would help some people to avoid osteoporosis, especially as they're in later years anyway. So moving on to erythropoiesis, red blood cells develop in the bone marrow. If any hemorrhaging starts or any destruction of red blood cells, it often leads to advanced marrow activity. This activity can increase production of red blood cells up to 8 times the usual speed. If this doesn't happen and blood continues to be lost, or red blood cells, then anemia develops, which is when the amount of destruction of red blood cells is much more than the production of red blood cells. The rate of erythropoiesis or red blood cell production is sensitive to oxygen tension in the arterial blood. As oxygen falls in the blood, red blood cell production increases. So in high altitude, where there's less oxygen, the red blood count will be quite high compared to a sea level, for example. If 1 pint of blood is lost, for example, the erythropoietin or EPO mechanism is activated, and red blood cell production is enhanced. Within a few weeks at least, red blood cells could be restored to the normal value. It's very precise, controlled, and the number of new blood cells often is equal to the number of blood cells that have been lost or destroyed. So looking at behavioral triggers, you could be talking about altitude, like moving to the mountains, for example. A physiological one might be anemia, where bleeding might have occurred, or hemorrhaging. And maybe a psychological one might be just trauma or shock, where the person's hyperventilating and their heart's pumping faster, and the body may be stimulated into producing EPO as a result, and more red blood cells. Just to cap, this is the cycle for EPA process, and you can see that the iron is recycled through the liver and gets transferred to the bone marrow, joins up with EPO again, stimulated with globulin, put together with vitamin B12, and then sent back again into the blood. Normally has a 120-day cycle at any given red blood cell. You can see there on the poster that the waste is eventually reduced into feces and urine. But you can see that the amino acids and the iron is reusable, but everything else, the biliverdin and bilirubin, etc., has to be goes down as waste. Yeah, thanks very much, and sorry that it's a little bit rushed.